Hello, everyone. It's Alysia Silberg here, founder of the Global Fireside Chats and general partner at Street Global. I'm excited to be joined by Christian Meyers, my business partner at Street Global, for this edition of our Fireside Chat. Happy Wednesday, and welcome to our first 2018 industry-specific Fireside Chats. Health entrepreneurs and investors formerly focused on traditional pharmaceutical and medical device companies who gained a great deal from their work. Now the pace of innovation is increasing because we have new technologies, tools, and business models. The level of participation is increasing among entrepreneurs and investors. Health tech is an expanding and exciting space. That's what we're exploring today. What's happening, the opportunities, trends, organizations, and issues at play in this great opportunity that will affect us all. I'm broadcasting to you from San Francisco, a place where I meet many entrepreneurs working to change healthcare. I'm very inspired by their example. This show furthers their efforts. I'm also thankful to be a health tech investor. I'm grateful today to be joined by some incredibly special entrepreneurs, investors, researchers, thought leaders, and organizational leaders working in financial markets, media, government, corporate development, investing, and entrepreneurship. For those of you who don't know, our topic for today is health tech, diagnostics, and their use. A look at those and other technologies changing the world. Now I've got your interest piqued. Let me go ahead and introduce you to our VIP guests before asking them to properly introduce themselves to you. Welcome to California-based Ken Kingatharan, who's an investor. Welcome back, Ken. Welcome to London and California-based Aaron Rachamim, who's a scientist and entrepreneur. Welcome to Florida-based Eli Carlin, who's a doctor and investor. Welcome to Florida-based Mark Rippon, who's a scientist, military officer, professor, and entrepreneur. Welcome to California-based Ryan Kurakos, who's a pharmacist, business developer, and entrepreneur. Welcome to Aberdeen-based Rohan Agrawal. And welcome back to Christian Meyers, my fun partner at Street Global. Now, let's go ahead and ask our VIPs to introduce themselves, starting with Ken. Ken, please say hi to everyone.
Hi, good morning, everybody, and thanks, Alysia and Christian, for inviting me again to join your wonderful show. My name is Ken Kingatharan, trained as a cardiovascular pharmacologist in London and also at Stanford. Over the last 18 years, I've set up multiple companies, BioTech. Also been on the investor side, running an incubator fund called Athena's Capital. My main interest is being able to combine diagnostic, device, drug, and digital, which is my main focus at the moment with a company called Orion, where we are pioneering a whole new business model around biotech involving diagnostics. Thank you.
Welcome, Ken. Very excited you're joining us. Aaron, please say.
Hi, everyone. Nice to be here. Thanks for having me on the show. I'm Aaron Rachmim. I'm the CEO and founder of Aphidia. We're developing a portable device to do 40 medical tests from a single blood drop in 20 minutes.
Welcome back, Aaron. Ellie, please say hi to everyone.
Good morning, everyone, and thank you for having me. My name is Eli Carlin. I'm a physician by trade, and I act as the Chief Development Officer for Flagler Investment Holdings. Flagler is a vertically integrated healthcare investment firm, and really our mission is to partner with the nation's most leading healthcare provider, improve clinical outcomes, and provide an patient experience. In 2008, early this year, the healthcare division of the Chinese multinational Fosun Group acquired a majority stake in our company, and we're looking to really disturb investment approach in healthcare. Thank you.
Welcome, Ellie. Super excited you're joining us. Mark, please say hi to everyone.
Hi, everyone. Thank you so much for having me on this chat. My name is Mark Rippon. I am the founder and CEO president for Allergy. We are developing a device that will allow people to know what their blood sugar is real time in a totally non-invasive way by using a wristband sensor that works with a smartphone application to give you real-time measurements on demand, and then also the trends so that you can see if your blood sugar is going higher or lower so that you can make the right decisions. Right now, with the prick and stick glucometers, you have to guess whether your levels are going higher or lower. And the other systems that provide continuous monitoring, you have to insert electrodes, or they're much more invasive. So I'm really pleased to be a part of this group, and I basically most recently was the director of engineering for Stanford Research Institute of Space and Science Technology, and developed some technologies that when I wound up trying to figure out how to do what no one's been able to before, just recently, to now I'm actually doing something to better humanity.
Welcome, Mark. Ryan, please say hi to everyone.
Hey, everybody. Excited to be here today with all of you. My name is Brian Kuriakos. I'm a pharmacist, product management, product marketing, and commercial sides. With Orfidia, we are a startup developing a portable lab system so that you can run lab tests anywhere and get rapid results.
Welcome, Ryan. Rohan, please say hi.
Hello, everyone. I'm director with Mirage Limited, which is a UK-based company. And we basically deal into the cross-border business, M&A, and deals advisory services. In addition, we also maintain investor relations and go for the capital raising. Personally, for me, this forum is something that I definitely look forward to. There's a lot of things that as a panel, we have a lot of experienced members here that can contribute. And the topic lies very close to my heart, being in the healthcare industry. Thank you.
Welcome, Rohan. And Christian, would you like to say hi to everyone?
Yes, please. Thank you, everyone, for inviting me and including me. I'm San Francisco-based Christian Meyers. I'm Alysia's business partner in Street Global. Together, we invest in early-stage startups, including many in health tech that are doing things such as making blood tests available to everyone in the world, improving hospital performance, developing antitoxins, and helping prevent blindness. So this is a topic very close to our hearts and minds. And I just have to say, wow, this is an amazing team of people. And I'm very excited to listen, learn, and enjoy the discussion with everyone. Thank you.
Thank you. I know you want to learn from our VIPs, so just a few quick shout outs before we jump into all the questions we have for them. You can contact our VIP guests. Their contact details are on screen. Feel free to reach out to them. Don't forget to keep sending your questions through to inspireme@onlinefiresidechat.com. We'll always do our very best to include them. Just a reminder, we have champions and meetup groups in over 60 countries around the globe, and we love hearing from you, so keep us up to date on all your progress. Thank you to all our volunteer champions from around the globe. You are the hearts of our community, and we wouldn't be here today without you. Over the next few months, with all your help, our aim is to empower 100 countries, so we know we're going to make this happen. Thank you to all the supporters and collaborators we have from around the developing world who are not only hosting sessions for hundreds of entrepreneurs who don't have access to necessary bandwidth or understanding of the English language to join our sessions on their own, but thank you also to the government ministries, UN offices, World Economic Forum, US Embassy Corners, British Council offices, university campuses, schools, business incubators, Chamber of Commerces, and radio stations for all your hosting support. We really appreciate your support, and thank you to everyone from UN Women. Now you're here to learn, and that's exactly what we're going to do. The topic for today is health tech diagnostics and their use, a look at those and changing the world. To make our VIPs feel really comfortable, we're going to pose a question to all of you. We're going to pose it for starters to one of you. So please sit back, relax, and have a good time. So our topic for today, as you all know, is very exciting. So let's jump on in and start learning. Our first question goes as follows. Talking about the future of health and medicine, let's set the stage. Now, please keep in mind that we do have a diverse and very general audience. And our first question goes to both Ken and Aaron. Ken first, often differentiate between diagnostics and treatments. Please, can you explain this to us? And from a big picture perspective, how should we be thinking about the two? Please go ahead, Ken.
Yeah, thanks, Alysia. I guess, in terms of diagnostics, one could say there's diagnostics, which is the actual technique of diagnosis, and diagnosis is a identification of a nature of illness or other problem by examination of symptoms. In this conversation, I'm not a technical expert, so I'm not going to say too much about that area. But instead, I'm going to talk about the use of diagnostics in treatment of diseases. Not too long ago, there was this concept called theranostics, which is a process of combining therapy with diagnostics. The idea behind that is you've got to know, what is happening in the body in order for you to figure out whether the body is out of sync with its normal physiology or not. And if it is, then, you provide the treatment. So in many respects, diagnostics is a technique that's used to figure out what's wrong with someone. And the treatment is something that you, match or try to bring that incorrect situation back to normality in or physiological situation for that person.
Thank you, Ken. Aaron, we'd love to hear from you too. Yeah, please go ahead.
Yeah, I think diagnostics is a way to, basically what we're realizing today is that diagnostics is another word for information in the healthcare area. So, with diagnostics, we're actually seeing a move to amounts of data that can be used to identify more precisely what is a deviation from normal healthcare, from a normal health state that is actually causing the disease for an individual. So this large amount of information, over time, is actually going to actually now enable the development of more advanced diagnosis, and also at the same time enable more advanced therapeutics to be developed, because we're actually able to pinpoint more precisely the actual cause and response to particular disease states. So that's actually where we're seeing the new type of diagnostic information actually then interfacing to potential new responses to that in terms of new therapeutics.
Thank you, Ken, and thank you, Aaron. Now, moving on, let's look at the big changes occurring with respect to diagnostic tools and health. We'd love to hear from you, Ryan. Starting with you, Ryan, please tell us a bit about medical devices, the collection and use of data, software, and AI. And go ahead, Ryan.
Awesome. Yeah, there's this is really an exciting time in the health technology space. There is, we're seeing a general trend that there's at one point, what we're collecting is data for, as Aaron was mentioning, information on different individuals, but typically looking for one single biomarker. As we are, the first part of it is understanding what the value of a specific biomarker is and the disease state that it will be able to inform you on. So what we're seeing is, as these tools are being developed and made available to the mainstream, certain technologies and platforms are able to now make this available to the general masses. So, but this is obviously a long process. Companies like Orphidia, as well as other technologies, are actually making it available so that you actually can get this kind of technology for different disease states and making it available so that everybody can get these kind of tests done easily.
Thank you, Ryan. Rowan, we'd love to hear from you here. And then Ellie, please go ahead.
Yep, thank you. So I believe the diagnostics is the tools that we use, the softwares that we use, and the data that comes out of it are very, very critical in finding and actually deciding on what treatment will be taken up by the medical professionals. So as we see, there has been a lot of upgrade, and healthcare is definitely one of the industries which uses a lot of technology. So diagnostic tools definitely need a lot of evolution. And coming from a very practical point, we often see that a lot of using even the same tool, the readings, or you can say the findings, could be very different. Use a X-ray or maybe a lab report, a blood test report. The values could be very different for the same person we have used. So I think the technology, the data, what is there, that plays a very important role in this. And as we progress through this forum, I think we'll also explore and uncover some of the aspects how the latest technologies and AI can boost this ecosystem. Thank you.
Thank you, Rohan. And of course, Ellie, please go ahead.
Sure. So I think one of the key aspects we see that we haven't seen in the past growing exponentially is the ability for the consumer to really take their diagnostic measures into their own hands, right? So you see groups like 23andMe and Viome. The consumer is really now able to take all of this, understand their healthcare, understand the diagnostic component of it, and then refer back to physician. And then on the other end of that, I think a lot of these groups then take that information and try to create other diagnostic measures further. So then you have the gene mapping, you have a lot of different things that will come out, so the consumer, the patient, if you will, has a much better understanding of their own personal health and really the healthcare in general. So I think with diagnostic tools and with respect to diagnostic tools in healthcare, there's a lot going on. It's really a cycle that feeds into itself the more we grow.
Thank you, Ellie. And I know Christian had some thoughts he wanted to share with our community here. Please go ahead, Christian.
Well, I just was going to tap some of the panelists' comments so that we're setting the stage. The thing that made it easy for me to understand is if we're talking about diagnostics is information about what's happening in a person or a population. And then we have treatments and therapeutics, which are designed to bring the body back into balance. And an interesting thing I'm hearing from the conversation is that these things used to be very distinct, but now that we're getting more information continuously about what's happening in a patient or population, we can move faster to apply treatments and therapeutics, tune them either to individuals or to make them more effective. And then, as Ellie was mentioning, there's a lot more participation in someone's healthcare. Patients, doctors, family members, researchers. There's a lot more contribution to the ultimate health outcome that a person can enjoy. So it's a very exciting time, and I can't wait for the rest of the conversation. Thank you.
Thank you, Christian. Moving on to our next question. It's to Mark, Aaron, and I know Ken's got some thoughts here too.
Yes.
Where will these diagnostics touch our lives? Could you paint us a picture of the future of health? Please go ahead.
Well, I think what's going to happen is that we're going to be using wearable devices that are going to be in form factors ranging from a wristband to actual clothing that could actually monitor your vital signs as well as other things. For instance, dielectric spectroscopy, which is what we're focusing on right now, allows us with ultra wideband look to capture the spectrum of a person, the biochemical spectrum of a person. And then we can, over time, start noticing variances in that spectrum. Now, everybody's spectrum is different. That's the other thing that you have to realize, that everyone's spectrum is going to be different. But we're going to be able to pick up on changes occurring that may be telltales or biomarkers of some other disease before it becomes obvious, manifests itself in a clinical environment. It will allow us to really understand dealing with, in our case, we're focused right now on diabetes, and if you can know ahead of time early enough, then you can take steps to slow the progression down. You know, a lot of these things, you can't stop it, but you can slow it down. Or in case of people that have things like they're borderline diabetic, you can really help them keep from going over the edge. So I think the way things are going now, the technology, it will be there in short time that will allow us to see things that we've never seen before, and also allow us to monitor people to see if something they're doing is affecting them, you know, without them having to take a test or anything else, because it's all happening it's automatic, you know, and I think that's where it's going to go.
Thank you, Mark. Aaron, we'd love from you.
Yeah, I think so. Today, diagnostics is really undergoing rapid change because we're starting to see the development of really new diagnostic sources, information sources. As I said before, diagnostics is really an information science, right? So you're looking for more information in order to make a better diagnosis. with the devices that Mark was talking about, you're actually able to develop more information from in terms of working information, in terms of steps information, in terms of external analysis. The Ophidia device to that, because you're able to also start to then bring in other types of information, such as your internal biomarkers, which are also very powerful. Where today we actually have blood tests that measure just a few of the thousands of different biomarkers that are actually in the blood. So being able to the potential of our microfluidic technology is that you can actually start to in parallel measure all of those thousands of different biomarkers and add that to other data sources to make much more advanced diagnosis. So you're able to bring in far, orders of magnitude more data than was previously available, and that's really what's going to push diagnosis forward. So that's really not. First of all, you're going to have actually the ability to develop those and measure those different parallel biomarkers. Secondly, being able to monitor those continuously every day, because you're actually able to take a much smaller blood sample, even even a drop of blood is sufficient to actually measure all those different data parameters. So you're really starting to see addition of multiple different data sources, including also genetic information, sensor information, and vast amounts of new biomarker information that's really going to change diagnosis going forward into a purely information data-driven science.
Thank you, Aaron. And Ken, I know you've got some thoughts on this. Please go ahead.
This is Ken. Let me jump in there. Really, I agree with many of the things that our panelists have said. One thing to note is that not too long ago, you tend to have a diagnosis or diagnostic activity done spread by a couple of days or weeks, etc. So you didn't get patient on a constant basis, something that I think Mark mentioned. Many of these markers can vary throughout the day, throughout a very season, and also whether you've eaten or not. And also what's also happening is that some of the very sophisticated diagnostic, like EKG or ECG, it's now you can do it on a watch or a small unit and do it at home. Naturally, the blood pressure, a lot of patients now do it at home. This is very, very helpful because a physician can, a doctor can understand what's happening to the patient much more in detail. Not only that, they can, if something is wrong, it can be spotted pretty quickly and not missed because the actual process of diagnosis was happening, at a spread out time period. The other thing that's important to note is that, with all these tools that are available to the patient, there is a lot of data overload, and this is something is a major concern for physicians because particularly things like an EKG readout, the physician may be getting calls from patients wondering what's wrong with them, and this is something that needed to be solved because that's where the big data analytics come in. Data analysis is very much the eye of the beholder, and hopefully there'll be a lot of changes in that space.
Thank you, Ken. Moving on to our next question. Ellie, in your opinion, what role will doctors play?
Patient goes to see their physician, right? They come in and they may see a nurse, and then they might go see their physician after that, and then they go home, and they might come back for a follow-up, and it's a lot of back and forth and a lot of wasted time and saving. So I think where we're going to is a lot of telehealth, where physicians will play a much more online and sort of at your fingertips approach for the patient, and require, I would say, more involvement with technology. I mean, the idea that augmented reality and some of those other techniques and tools where a patient can see their physician, not necessarily in a brick and mortar location, but potentially in their home, and physical therapy is one of them, where you think something like that, you need to go see your PT and go see maybe your orthopod or what have you. A lot of those measures now can be done in your home via the new technology, and I think that's where physicians are really shifting. I see that in our practice, at least, where physicians are looking to create a cost savings using those metrics for the patients and for the insurers.
Thank you, Ellie. Rohan, would you like to add anything here in terms of the role doctors will play?
Yes. I think when we see how the doctor's role would be here, I would like to highlight two different aspects. One is how the technology and the diagnostic tools complement the doctor's work in their everyday, day-to-day life. And when I talk about, let's say, when a patient goes to a doctor and he tells about his symptoms to the doctor, and doctor, based on the data, if he's backed by technology, he can quickly pull out a lot of information, maybe more than a reactive approach. He can take more of a proactive approach on what kind of further diseases or maybe the ailments that a person can develop based on a certain symptom or a certain condition, and what kind of other analytics the technologies can offer to the doctor. So this is one way that it can, I would say, complement their work. At the same time, when we see technology as of now, when we move towards more technological advancements, we have not yet reached a stage where doctor's role, we can ignore it totally. And when we talk about biology and human body, it is we see a lot of cases of exceptions. And unlike physics and chemistry, biology is a science of exception. So no matter how the technology goes, I think doctor's role will definitely be very important to certify what results are coming out of the technology.
Thank you, Rohan. Moving on to our next question. It's for Aaron. Aaron, when will we all be getting DNA mapped, in your opinion?
So the cost of like a full sequence has dropped to around $800. So we expect to see further rapid decrease in the cost of full genetic sequence. So we anticipate, I anticipate that in a few years we'll all have the opportunity to do that very cheaply. So I think we're looking at over the next 5 to 10 years, a full sequence, and we'll have a full genetic map for every individual.
Thank you, Aaron. Next question is for Mark. How soon do you believe we'll have virtual reality doctors?
Well, when I was at SRI, one of the things we worked on was a robot that could do surgery actually better than the doctor. It could be ultra finely tuned, and the doctor could actually remotely do operations. And I think it's a ways away from actually being able to have a virtual doctor because we still haven't been able to human intelligence in any of the devices. And there's a lot of things that go on in making decisions that a human does that are difficult to emulate using artificial intelligence. But we can augment those things and make them better. And actually, physicians with a AI assistant, if you will, so they could doing the diagnosis, they can have other inputs that they may have not remembered, rather than going to the Merck manual and looking up the symptoms. So just kidding, but I think it could help them look at other things that are not obvious. But I think it's a long ways before you're going to have a artificial doctor, AI doctor.
Thank you so much. And I know Ken had some thoughts he wanted to share here. Please go ahead.
Yeah, just to echo what Mark just said, we're really quite far from seeing, artificial intelligence-based doctors. I mean, I know everybody uses the word artificial. We're some way away from that. I tend to use the word augmented intelligence because that's what we have. In terms of, we've seen demonstration not only at Stanford but also in Australia where AI-based system can collate all the information much more efficiently than a clinician, but it assists the clinician in a positive direction, especially in orphan rare disease where the patient characteristic is very unusual. Having an augmented intelligence system to diagnose the patient is very, very helpful.
Thank you, Ken. Moving on to our next question for Ellie. When will we all be treating ourselves?
That's a great question, and I think that for the most part, and if we're honest with ourselves, a lot of us and I would say, especially in the millennial generation, use Dr. Google, right? Where we go and search symptoms and look, okay, what do we have? What's going on? What do we do? And then if and when those symptoms either worsen or go away, then we decide, okay, do we actually go to the physician and try to attain a better answer? So I think that in a sense we're already there. However, I would say that it's still some ways away where we'll actually have the ability to really have any sort of machine or something in our own home setting where it can treat us like a physician would based on their clinical expertise, right? So in a way we're here and in a way we're not.
Thank you, Ellie. Ryan, the next question's for you. In your opinion, where will we be investing our efforts to be more different in terms of more pre-disease investments? Please go ahead.
Sure. So from a pre-disease investment, I think there's a lot of opportunity. Just as I was saying earlier, one of the major things we want to make sure we can do is track disease earlier for patients. So there's a lot of the chronic diseases. You're seeing a lot of investment in the cancer space as well. So a lot of cancer diagnostics where people are looking to catch cancer earlier for patients. So, before you even know this is, you have cancer. So we are seeing that a lot with a lot of different diagnostics tools that are coming to the market, and adding this data obviously to your map DNA as well will be very valuable as well, so that you can track it for yourself as well as for different family members.
Thank you, Ryan. And I know Mark had some thoughts he wanted to share here. Please go ahead, Mark.
Yeah, I mean, people with chronic conditions like diabetes are in the process of having to diagnose themselves, in a sense, every day, in terms of trying to control and regulate their body's issues. Don't even have access to endocrinologists, and physicians are not really well trained in understanding what's happening in their cases.
Thank you, Mark. Now, next question's for you, Ken. Let's talk about fitness, acute care, disease management, mental health. I know we've been touching on it. What excites you? What are you seeing?
Yeah, I think for me, the concept of disease management is very, very exciting. The main reason is I've spent a lot of time developing drugs, but over the years realized that just giving drugs alone is not going to be enough. You got to provide a lot of other things and to know whether the drug is working very well or not. So one thing that's emerging, and I hope this takes off in a big way, is the tying up of the diagnostic to the way the drugs are delivered to the patient in terms of quantity, just like a electronic fuel injection, a carburetor, for instance, in cars. At this point in time, people are dosed once a day or twice a day, regardless of the status of their disease.
Thank you, Ken. I know Aaron had some thoughts he wanted to share there. Please go ahead, Aaron.
Yeah, so basically, we're able to basically really increase the speed at which diagnosis is taking place, and link this to direct responses in terms of medical treatment. And especially as it starts to become more data-driven, is able to be then automated in terms of specific algorithms which can actually lead, more specifically identify the response, more specifically identify specific disease and the appropriate response to aid the physician in actually making more precise diagnosis and more precise treatment responses there. So this is then able to then be linked to specific treatment responses in terms of specific drugs, medication, and devices as well.
Thank you, Aaron. I know Christian had some thoughts he wanted to share with our community here. Please go ahead, Christian.
Well, I just wanted to tie some things together that we have an opportunity to see through our investing work. That's entrepreneurs and investors, like the people we have on this panel, are creating business opportunities to improve health by using devices such as our iPhones and incorporating data that can be received through things we already use, but they're also pushing the boundaries of science. And Aaron, for example, is replacing a traditional blood lab with a very small plastic chip that can perform blood tests. And the combination of all of these devices is increasing. This is something we've heard a lot in this conversation. The volume of data we have about a person, from say 10 things to 100 to 1,000. And in addition to collecting all that data, people are creating businesses with software to analyze it. And the combination of all that data and software allowing us to understand what's happening within someone earlier and earlier, so that we can start to create other treatments and therapies for people before things even manifest in their bodies. And what we see is we see entrepreneurs working on all of those different segments, and the examples people use also get me excited. Mark was talking about surgical robots. There's an incredible future, and I really enjoy hearing the examples that the panelists are sharing. So thank you very much.
Thank you, Christian. This next question goes to Rohan, and we'd love to hear a global perspective with regard to diagnosis, treatment. Will medical advances create a more or less even world? Please go ahead, Rohan.
Yeah, thank you. So when I take a look at global perspective, I think, first of all, a difference in the healthcare systems does create a bit of a challenge, and also the advancements, availability of advanced technologies in different countries do create a bit of challenge in better diagnostic tools. However, as we go for a better connected world, and with the evolving use of technologies, and as we see the iPhones, the Androids, the applications that are getting introduced into our day-to-day life, and the way we are getting connected in terms of services. So we have got a better channel to connect to different doctors. In this way, I think there is a lot of opportunity to leverage a lot from all these technologies that come up. But yes, there will be a lot of local regulatory and governing frameworks that might apply and create a bit of difference here.
Thank you, Rohan. I know Ken had some thoughts he wanted to share here. Please go ahead, Ken.
Yeah, from a global perspective, I think the catch a particular cancer early on, because as many people who worked in this space, either as researchers or as clinicians, know that almost all cancers are managed better, and the outcome is better if it's caught early on. One great example is the cervical cancer and the HPV test that goes with it. It's a very simple and inexpensive test. It's offered to a lot of people around the world, and the cervical cancer is caught. It's very much treatable. And equally, a colon cancer, for instance, because colon cancer tends to be spotted very late on or late stage in the disease. That's why it's got one of the highest death rates. But if that cancer could be caught much earlier on, because there are some diagnostics that's available, and many of them are becoming available, and it could be used around the world, then I think one could have lower prevalence or number of people suffering from cancer.
Thank you, Ken. Moving on to our next question, we'd love to hear from you, Mark, and then of course from Ellie. In your opinion, what countries are leading from an R&D perspective and a regulatory perspective, and could you possibly touch on any current or future regulatory landscapes? And what do you believe governments should be doing?
Yeah, I mean, one of the big issues we have in this country in putting a medical device or a pharmaceutical product out is you've got to go through a very stringent FDA approval process, which really slows the introduction of the technology to the people that need it. Now, it was interesting. I'm not a Trump fan, but it was interesting that one of the things he brought up in his State of the Union address was that there was a need to make advanced technologies available to people without all the red tape that you have to go through right now, that people don't have to go to other countries to get treatment because of our process. And everyone, of course, understands the risks and the liability is an issue, obviously. But I think that that has made the U.S. have a harder time in competing with other countries because the overregulation has just made it difficult. And so, China, where they don't have that preponderance of oversight, and Europe is much less than here. So they have a kind of a advantage, and a lot of U.S. companies are going there to do the testing for that reason.
Thank you, Mark.
I would say that Europe and the European Union are forward-thinking in their ability to bring curative or important products to the market. An example of that is Abbott, I believe, only recently to the US came out with a continuous glucose monitor, and 24 hours a day to detect your sugar. And we had other CGMs, continuous glucose monitors, in the US. Prior to that, it really took Abbott quite some time because of those measures in the US are starting to develop and really go through a rigorous process in China, so that when they come to the US, they can show the FDA years of data there. If they were to do the same, it might take 10 or 15. So we see European countries and China as really the next behemoths in healthcare technology.
Thank you, Ellie. Rowan, I know you had some thoughts to add here. Please go ahead.
Yes, I think I would like to add one quick point. Is for the budding entrepreneurs in our audience group. So here is an opportunity for you to tap into the data. As we see, a lot of different countries will come up with their own regulatory of artificial intelligence and the blockchain in healthcare. Thank you.
Thank you, Rohan. Christian.
I just wanted to talk about how, when it comes to health, all of these exciting opportunities to use devices and data to develop new diagnostics and treatments. But what's different about it is often these things and their ability to get to market and to start generating revenue, they are dependent on the regulatory climate in which they're being released. And so as investors, Alysia and I are always trying to understand the risks and opportunities from a regulatory perspective that may either help or hinder products getting to market. So it's an interesting factor that you don't see in other aspects of our investing work, such as investing in cybersecurity. And I would just highlight that for the entrepreneurs on the call, that having a thorough understanding of how you're going to navigate the regulatory climate in which you operate is key for convincing investors that you know what the risks are with your business. Thank you.
Thank you, Christian. Moving on to the investing side of things, we're going to pose this first question to Ken. Ken, how are investors participating? What is the general investing climate like? What do you feel is important for our community listening today to know? Please go ahead.
Yeah, thank you, Alysia. Yeah, in fact, it's a nice segue into this question. One of the biggest issues in investing in diagnostic has been the ability to get reimbursement from from insurers who want a lot of data, validation data, to show that the biomarker or the diagnostic or the information that's gleaned from that is predictive of the information is meant to provide. Yeah, that's one. And then, of course, the lack of patenting around, say, genetic markers, etc., and the fact that the kinds of companies who tend to buy diagnostic companies, they want you to be commercializing your product versus like in the drug, when you develop something, even mid-trial, you can sell the company to a drug company, but that's not the case in the case of diagnostic. So all of these has led to not so much investment going into diagnostic. Hopefully that will change over time.
Thank you, Ken. I know Mark had some thoughts he wanted to add here. Please go ahead, Mark.
Yes, this whole FDA thing really puts a damper on fundraising because most guys want to get their return on their money in 3 to 5 years. And if you tell me I have a 10-year path, they just walk away. So it makes it a challenge. Fortunately for us, there's a precedent that has been set, as was mentioned, a watch called Pandera that used dielectrics. So it makes this much easier for us because we're also non-invasive. So we can take a 510K plan, probably get it through in less than a year based on our discussions with the FDA at this point. But I feel sorry for other people that are going to have to take 5 to 10 years, that the Europeans and the Chinese don't beat us to the punch.
Thank you, Mark. I know Rowan also had some thoughts here. Please go ahead.
From investment side, we do see a lot of changes in the venture capital side with the rise of venture philanthropy, and also the impact invest. We see that venture capitalists are more looking to fund the seed stage companies in the healthcare ecosystem. So I would say for investors, my advice would be to take a bit of risk. At the same time, I would also request the government regulators and to see how they can use artificial intelligence, fast-pacing the authorization of the diagnostic tools and the medicines. Thank you.
Thank you, Rohan. Moving on to our next question. It's for all our entrepreneurs around the globe who want to hear from our entrepreneurs on our panel today. What are the big opportunities for entrepreneurs in the space, Aaron?
Yeah, I think there's big opportunities in terms of anything related to health data, whether that's also gathering new sources of health data through devices, whether that's finding new ways to process health data so that you're able to automate or improve diagnosis rather through new potential big data or AI algorithms. So anything which is really creating or utilizing data is actually moving forward really fast right now. And secondly, process and utilize that data.
Thank you, Aaron. Moving on to ethics. In your opinion, what are some of the top ethical considerations we need to be keeping an eye on? Please go ahead.
So I think that's a great question. There's a lot that can be added to it. And since we've spoken about diabetes, we look at the different types, right? Type 1 diabetes, which for the most part is genetic. Type 2, which you could say is epigenetic side factors that affect the devices that we're creating and how are they actually helping, right? So, and I'll use the example of type 2. A lot of I would say a good portion, maybe 90% of type 2 diabetes could be eradicated with basic diet and exercise. So when we create these new technologies, are we in fact helping the population? Is it ethical to create and put the population potentially expensive technologies, or should we be really looking at the basic fundamentals to shift the way healthcare is treated?
Thank you, Ellie. And I know Mark had some thoughts he wanted to share here. Please go ahead, Mark.
Yeah, I mean, one of the issues that I've run into with some investors, they're not happy that my system is going to actually save money over what people spend on a prick and stick glucometer system. They want me to charge 3 or 4 times that cost so everyone can make a profit. I'm driven by my wife's condition, and I will not sacrifice, because we can make a very good profit and be less expensive than what's available now. You know, I'm going that route, but there's a lot of pressure. These people that you know, like for instance, I have gout and I take colchicine. It went from 8 cents a pill to $16 a pill. I mean, and that's being driven by, you know, I think a lot of greed. So the big ethics issue I have is I can't believe the amount of greed that's out there.
Thank you, Mark. Ryan, regarding security, it's hard to secure internet devices. We just saw, for example, that Strava, a fitness tracker for runners, revealed movements of military personnel. Is this going to be a problem in the areas of medicine? Please share your thoughts, Ryan.
Yeah, so I definitely think it's going to be an area of concern. That's why there's a large scrutiny in terms of some of the regulatory burden that you're seeing with the tech providers who are going to market as well, and as well as tying in some of the questions you got asked earlier in terms of interest from investors to invest as well. So this is a big area. The good thing is there's been a lot of great work that's been done in terms of best practices within healthcare and outside of healthcare as well from a security perspective. So it's always about bringing in the best practices and then always staying ahead of the curve. I think one of the interesting technologies that we'll sort of see over the next coming years is blockchain technology and how that will allow for patients to securely share their personal data as well, which I think will be interesting to watch.
Thanks, Ryan. I know Ken had some thoughts he wanted to quickly share here. Please go ahead, Ken.
Yeah, that one of the things that we are trying to pioneer is have a single price for whether it be drug, diagnostic, or device, so that patients are not paying too much for the device and the diagnostic on top of the drug. Regarding the security, I think it all comes down to whether the device needs to communicate with the central system or not. So it really comes down to kinds of ability for an external system to communicate with the device. Because if there is no security, then it's a problem.
Thank you, Ken. Now, our favorite part of the show, we get to ask our VIPs, what excites you and what industries do you think are ripe for disruption in 2018? And we want you to give us the first answer that comes to mind, starting with Ken.
Device industry is ripe for disruption, especially with the data analytics coming from augmented intelligence and the combination of these diagnostic drug and device coming together and doing what we call disease management.
Thank you, Ken. Aaron, what excites you? What's ripe for disruption?
What really excites me is the opportunity for big data in healthcare, because we're actually going to see really vast new data sources come online, and there's plenty of opportunities for new technologies, new startups to look at how to exploit that data. And we're really going to see unification of traditional diagnosis, medical diagnosis with big data analysis to create a whole new version of information data-driven healthcare.
Thank you, Aaron. Ellie, please go ahead.
Sure, I'm really excited about seeing how we're able to create curative treatments for existing conditions and future ones, and the trillions of microbes, and a really interesting next step in healthcare.
Thank you, Mark.
I see some really incredible progress in different platforms such as wristband sensors and body clothing type sensor systems. I'm really excited about putting all this data together, and I think that's really opening up the door for a lot of stuff. So my bit of advice is never give up.
Thank you. Christian, please go ahead.
I'm excited about getting more funding by working with you to standardize the process and bringing more investors. Thank you.
We're going to ask our VIPs to prepare their tweet piece of advice, just to keep you posted on our upcoming sessions with some of the world's best joining us again as VIP guests. On February 7th, we have Artificial Intelligence and Industries, a look at artificial intelligence applied to specific industries. On February 14th, we are diving right into data and new tools, how data and our tools for applying it are creating opportunities and changing our lives. Remember to keep us up to date and on your progress and exciting news. We love hearing from you. You can always email us at inspireme@onlinefiresidechat.com. You can find me as well as our champions and our VIPs on LinkedIn. Now let's ask our VIPs to share their tweet piece of advice, starting with Ken. Ken, please go for it.
Yeah, my tweet piece of advice is treating a disease without diagnostic is it's like trying to drive a car without a speedometer.
Love it. Aaron, your tweet piece of advice.
Data is transforming diagnostics.
Thank you, Aaron. Ellie.
Thought of as a living organism, and really you get out what you put in.
Thank you, Mark.
I would say that look at the changes in materials and processing technologies, and realize that there may be some things that could be developed that are not evolutionary but revolutionary if we can just go back to looking at from scratch.
Thank you, Ryan.
This is just for all the entrepreneurs out there, but with the right willpower, you'll get it done.
Thank you, Rohan.
So this is especially for the entrepreneurs, investors, and the regulators. Please share the burden of making the innovative solutions cost effective. Thank you.
Thank you, and Christian.
If you're a health tech entrepreneur, get to know other health tech entrepreneurs. Thank you.
Extremely good advice. Thank you, Christian. It's a privilege to learn from extraordinary people such as this. And it's a privilege to be an entrepreneur, to be building your dreams. So never take it for granted. We are very, very fortunate individuals and communities and people. We're changing the world together. Thank you also to Darren for producing and leading our technology for today's show. Thank you again to everyone. We want you to have an amazing week. And remember to keep hustling and to never give up. On the count of 3, I'm going to ask our VIPs to shout bye. And we're going to see you next Wednesday. 1, 2, 3. Bye, guys.
Bye.
Bye.